Good morning, my YouTube viewers. It is Palestine here. I'm just on my way to my day job, but I want to make a really short video to talk about something that happened over the weekend with regard to my radiotherapy. And basically, I had my radiotherapy at the end of September, the middle to the end of September. And what they did was they just performed radiotherapy on my left breast, and then that was for 5 days, I think. And then they targeted it where the tumor was for 3 days. And so I was sick. I got a cold when I finished my radiotherapy treatment. And so I was sick. And then whenever I finished my radiotherapy treatment, I went to a wedding in London, and I was sick at that wedding in London. And then the following day, I got confirmed, and I was sick when I got confirmed. So it was just a shame that I was sick those 2 days because I couldn't reschedule the events. So I had to go to those events sick, and that wasn't very nice for me. And then I guess about 2 months after I had the radiotherapy, I got a really terrible rash underneath my breast. And I think that was caused by the radiotherapy because I didn't get it on my right breast. I only got it on my left breast. But fortunately, it cleared up. And so I was happy that it cleared up. And then what happened last week was on my breast, close to the nipple. I had something like a mole. It was like a blemish, but it was a mole. Something like a mole. I don't know if they would call it seborrheic wart or something, like maybe a liver spot or a mole or something like that, but I considered it a mole, but maybe it was a seborrheic wart. And basically, I never paid a whole lot of attention to it. I knew that I had it, but I didn't pay a whole lot of attention to it. Well, it took about 3 months, but this mole, that's what we'll call it, as a mole, and it turned black. And I thought, well, what's wrong here? What's going on here? My mole has turned black. And so I just decided that I'd leave it alone and I wouldn't mess with it and just let it stay black. And then I just assumed that that was a result of the radiotherapy treatment. Well, last week, when I was getting out of the bath, the middle bit of the mole fell off. And under the middle bit of the mole was fresh skin, was regular skin. And then so I thought, well, what's gone here? And then I thought, well, I'll leave it alone. But since I had the circle around the mole was still there, but the middle of the mole had fallen off, I thought, well, I did a little bit of picking and I was able to get the mole that was encircling the main mole off, and underneath that was skin. So basically what happened was this mole, it took 3 months for it to happen, but it turned black. So I guess that's necroisis or something. And then it fell off. So I thought, well, that's good. I never really particularly like that mole anyway, so it's a good thing that it fell off. So I'm just assuming that that is a result of the radiotherapy treatment, because when I went to see the oncologist said that radiotherapy like sterilizes the area. So, and they said that one side effect of the radiotherapy is that you could get cancer, or because it was so close to my heart, then it could also cause heart problems as well. So radiotherapy is not without side effects, but I guess they decided that the benefits outweighed the side effects. But I thought that I would just go ahead and make a video and let you know what happened following my radiotherapy treatment, that a mole took 3 months, but a mole had turned black and then it had fallen off, which is fine with me. And so that was a side effect of my radiotherapy treatment. So I'm still not feeling very well mentally because I'm having these financial difficulties that I cannot speak about on YouTube. And this afternoon I have to go see a charity and talk to a charity and see if they can help to resolve the financial difficulties, because this organization is not responding to me. It's not helping me. So I have to go to a charity, and then a charity has to phone that organization and ask them for help. So, and then tomorrow I have an appointment to see the diabetic nurse, where I'm going to have to say that the doctor wants me to take Monjaro. So I'm going to have to take Monjaro in addition to all the other diabetic drugs that I'm taking, I believe. But that's just it. That's what I wanted to talk about. I wanted to tell you about a consequence of me getting radiotherapy, because I thought it might be useful to you if you're getting radiotherapy and maybe you've had a similar thing happen. One thing that I have noticed is I do have pain around my breast where the operation was, and then I do have pain around my arm, but I don't want to investigate that too much. I'm just hoping that'll go away, but that could be a consequence of me having 2 lumpectomies and radiotherapy. So we'll just have to wait and see what happens in that regard. So thank you very much for watching my video. If you like my video, please like and subscribe. And I'll be making another video for you in the next 2 days to let you know what happened when I go to see the diabetic nurse, and I tell her that the doctor wants me to take Monjaro, and that's not going to be fun. I'm going to have an injection every week because I know someone on Monjaro and he has to take an injection every week. So thank you again for watching my video. I'll be making another video for you soon.